The following segment is sponsored by Citron Cardiology. Right now, I'm joined with Dr. Ben Citron of Citron Cardiology. And Dr. Citron, today we're talking about medicine. So when is the best time to take your medication? All at once, or should we be dividing it up?
That's a great question I get a lot. Probably the best thing to do in this situation is talk with your doctor or nurse and see when they think you should take your medications. Some medications are best taken on an empty stomach, some with food. Some of the medications are best taken divided. I don't like taking all the medications at once because it seems like you get a meal in your stomach and then you can't eat. So if you can spread them out over the course of the day, that's very helpful.
That makes sense. Something that I struggle with is what time of the day are we to be taking our medication? At morning, or is nighttime better?
It depends on the medication. The fluid pills, we call them diuretics. Those are probably best taken in the morning so you're not up all night running back and forth to the bathroom. Some of the medications like calcium blockers, Norvasc, amlodipine, I usually have people take those at nighttime because that will limit the swelling that they'll have in their legs. And then the statin drugs which treat cholesterol and aspirin, that's best taken at night. You get a better effect that way.
And Dr. Citron, as a cardiologist, how do you keep fluid down if you have heart failure?
That's sort of the million-dollar question we get all the time. There's a couple tricks with that. One is just to remember that whatever you put in your body has to come out. So I usually limit people to 2 to 3 quarts a day, especially if they have a lot of heart failure. The other thing to do is watch the salt intake. Just don't add salt to the food that you eat. We also tell the patient something we call wait and elevate. Have them take the medication, wait 30 minutes, and then elevate those legs up for about 30 minutes so all the fluid will come off pretty easily. And those are some helpful things that tend to work.
And in terms of helpful things, do you have any tricks with our blood pressure?
Yes, the biggest thing with blood pressure is make sure you have a good cuff and make sure that you're taking the blood pressure the right way. You have to have your arm relaxed. You have to make sure the cuff is neither too small nor too big, and you relax when you do it sort of the same time every day, and keep a log of it. And often we actually have to show the patients or have them bring in their cuff to make sure it's calibrated correctly. And this is a situation which, like heart failure, you want to get a calendar out and every day write down the blood pressure. Make sure that you're keeping a good, accurate accounting of it, just like you do with your daily weights for your heart failure.
And as an expert, Dr. Citron, are there anything else that you suggest?
Well, you've heard me say it before. I like people to eat 7 to 10 colors a day. I like them to, and that's fruits and vegetables, that's not other things.
No candy.
A drink or 2 of alcohol a day is probably fine. Probably 1 drink 4 or 5 times a week for women and a drink a day for men is probably ideal. Walk at least 2 to 3 miles a day. That's 5,000 steps. And you can use these newer apps that they have that will actually tell you pretty well how much you're walking. And write things down. You know, make sure you sort of keep a good tracking of what you're doing. And every day I like people to check their pulse. You know, reach down below the thumb and feel the pulsation and check that to make sure that it's regular and nothing has changed, because that could be a call to action, so to speak. And lastly, make sure you have a good laugh every day and you relax a little bit every day. And
it'd be a great gift to maybe get someone a watch that keeps count of how many steps you're taking.
Exactly.
Thank you so much for coming in. If you would like to make an appointment and see Dr. Citron yourself, check the information on your screen.